Today I want to talk about cognitive behavioral therapy and why it helps if you're struggling with insomnia. Some of you have had problems with sleep for many years and you don't really know what caused it in the first place, only that it's been getting worse and worse. But for many of you, the sleep problem started because you had too much stress in your life or because you were going through some kind of trauma. And even if you managed to heal your wounds or managed your stress and move on with your life, very often the sleep problems remain. It has become a bad habit or a bad pattern that you just don't know your way out of. And if you see a doctor, then all you get is sleeping medication or some sleep hygiene advice. But the problem is that the sleeping pills loses its effect over time and you get addicted and you need more and more, and it doesn't really help you in the long run. And if you have become a chronic insomniac, then sleep hygiene is really not enough to cure the problem, because honestly you have already tried it all. So there can be many different reasons why people get sleep problems. However, when people become insomniacs over time, they start behaving remarkably similar. Many of my clients, they reach out for help because they feel that they have lost control over their sleep. And to compensate, because they are so tired all the time, most of them spend up to 10 hours or more in bed every night. But they sleep maybe 5 hours. So what you need to know is that sometimes being tired is not the same as being sleepy. And most insomniacs go to bed before they should because they think, I'm so exhausted, I'm so tired, so I really need to go to bed now. But they're not sleepy enough because they have not built up this sleep pressure that they need to get good quality sleep. And also, you need to challenge your own thoughts and beliefs regarding your sleep. Because think about it, does it really help to spend all this time in bed, tossing and turning with racing thoughts and sometimes even feeling panic and anxiety? So instead of thinking that bad sleep has control over you, now it's your turn to be in control over your sleep. So what we are working with in cognitive behavioral therapy is changing and removing all your bad habits regarding your sleep. It is all about learning to sleep again and removing all the bad habits related to your sleep. So we need to change the factors that maintain your sleep problems and to overcome the underlying causes of it. We will focus on changing your thoughts and behavior regarding your sleep. Because sleep problems are really a wrong learning where the bed is associated with wakefulness instead of sleep. And everything is a combination of thoughts, feelings, your behavior and your reaction to it. And we need to go into depth of it to change what is happening. Remember, often what happens when you go to bed and try to sleep, whatever you haven't dealt with during the day will come to the surface. Because you can't escape your feelings, but you can change your thoughts that created your feelings. But feelings that comes from your body is different than head-created feelings. So we need to work together on different levels and also focus on calming down your nervous system so that your natural state of sleep will happen at night. Our main goal with the therapy is for you to achieve good quality sleep without spending too much time trying to fall asleep and to avoid long nightly awakenings or waking up too early. And what determines whether you have had good quality sleep is actually how you feel when you wake up the next morning and during daytime. The quality of your sleep is very important, but not necessarily the length. Because everybody is different and everybody has different sleep needs. And also, cognitive behavioral therapy for insomnia is recommended as the first-line treatment for people with insomnia, as it is far more effective than sleep medication. And remember that sleep is a natural state. We need to remove whatever it is that is hindering you to be in this natural state that makes you fall asleep naturally and stay asleep all night. So please contact me on Christine's website if you're ready to take control over your sleep again and get healthy sleep habits. Thank you so much for listening.